Hey listeners, after the pod, don't forget to claim your free 2-week trial on the Better Yoga Online Studio. You'll get unlimited yoga and breathwork classes guided by expert instructors. We're a small women-owned business, and you signing up for the free trial really makes a difference. Now here's the show.
Hello and welcome everybody to the Better Yoga Podcast. I'm your host, Tiger Bai, and today we have a very special guest, a colleague and friend of mine, Perrin White. Perrin is a speech language pathologist, certified orofacial myologist, registered yoga teacher, and breath coach. She does it all. Perrin blends her professional expertise with personal experience in airway health and mindfulness to teach others how to breathe and be well. She works to use functional breathwork, a powerful method that integrates nasal breathing, tongue rest posture, diaphragmatic engagement to optimize health, performance, and nervous system regulation. She helps clients of all ages correct dysfunctional breathing at the root. And this includes sleep apnea, hyperventilation, brain fog, clenching, snoring, and of course, mouth breathing. She is the founder of Breathe Well, Be Well. You can find her on Instagram, all the social media. What I love about Perrin is that she is so committed to informing, empowering, and supporting every client she works with, one breath at a time. So welcome, Perrin. Thank you for coming on.
Oh, Tiger, way to pronounce all the words correctly. Great job.
I do rehearse that part because, all these specialties, got to have the anatomical pronunciation.
Thank you for having me. It's an honor.
So, Perrin, we always start the podcast with the same question. Interpret as you may. What does your practice look like nowadays?
Well, I'm saying that because it changes so much. I mean, the through line is always grounding within yourself. So grounding meaning like find that shred of you, that's always there, whether it's something you know to be true, something you know how to do, something that you know you love and loves you. And for me, that's a functional breath. I'm especially kind of like, oh boy, because currently I'm a week out from gum grafting surgery, like I was telling you earlier. And I always am just fascinated by the emotional components to things that are just completely glossed over or not even really tapped into. And I am having some major, just like emotional awakenings where I think it's twofold. One, I'm coming off of the pain pills they gave me. Two, it physically hurts. Like my mouth was profusely bleeding the other night, which is like really scary. And three, remembering that the jaw, the mouth is where you speak your truth, you hold all these emotions, and it's just unearthing all sorts of things that I forgot about personally. And I'm having to face them and having to come to terms with what do I want to do about it. And so for me, currently, it is being as soft and as easy as I can. Like when my mouth started bleeding the other night, it was like, parents, slow down. Like, slow down. You are not even close to being healed. And then when like these emotions arise up, and what I'm talking about specifically is like having these pain pills and steroids from the medication, it kind of reminded me of my earlier Adderall use. And so it's almost like I relived my youth where I had like some manic episodes where I was just cleaning the house. So all my kitchen and bathroom sinks are completely clean now. Con, I had to like remember what it was like when you came off of it, of like just sitting with what is. And I remember why I loved like that almost completely dissociative, get shit done feeling of Adderall, which I kind of felt like when I was on the pain pills for this surgery of, you don't have to feel anything. You just get shit done. You get all this stupid shit done, like clean your kitchen, declutter your bathroom. I mean, I love seeing a clean bathroom now, so it's not all bad, but I just relived all these moments. And also when I was cleaning, I found all this stuff from my college years of right before I was about to go into Adderall use, and before I even had a clear understanding of what sleep disorder breathing was, and I found something that said um, my habits was falling asleep everywhere, and I'm just like face plant because I'm like, oh, that is sleep disorder breathing, and no one, especially myself, had any idea that the body was screaming so loudly. So my practice specifically today is take a slow, deep breath and maybe even like find a place on my body that hurts or feels achy, which actually is all my body right now, but specifically like the heart. And I just remember I'm right here and I can breathe and it's okay, and hold space for what you feel. Place your tongue in the right place. Breathe with your ribs expanding, and then decide what you want to do about it. And what I want to do right now is talk to you.
Well, I'm so glad you're here despite the surgery and everything that it brings up. Y- I find that as somebody who works in the quote unquote health and wellness industry and really living in and working in this industry, there's a lot of not demonization, but definitely kind of uh dislike toward some Western medicine and Western therapies. And I recently was with a family member in the hospital last week, and my biggest takeaway is it's not one or the other. It's finding ways to braid them together, because when you're in a severe amount of pain, yes, breathing helps, puts you in the center of your circumstances, allows you to be more present and proactive, but it's not going to cure your pain. Like when you're really in pain, it's okay to take medication. And I think what you mentioned about the process of coming off the Western therapy, using the ancient, the Eastern, more mind body practices, that's really such a moment of opportunity. And I can't help but think how many people it just might not be a part of their wherewithal to use tools like that yet. Um, and what a gift it is to have a practice, even if it at the moment is deviated from what we wish it looked like or what we wish it felt like.
Oh, you are hitting the nail on the head. The both and the more I learn, the more I know I don't know, but I am 100% certain there's always a both and to everything. So when I was talking about the emotional side, like, yes, there's physical pain, but it's honestly just as much emotional pain of things that I've buried that I haven't really revisited. And what's really cool is I can revisit them in my wise mind now, knowing what I know and what I've gone through and what I've learned about breathing and nervous system and mental health, and I can actually have a conversation with them versus stuffing them down. And I I agree that like Western and Eastern, ancient and modern, they're all necessary and they all have a place. And it's finding that right combination for you. And then the last thing is I'm not mad about what's happening. I'm honestly well, honestly, if you found me this morning, I'd be like, oh, I hate it all. But I like had some time to process it and like journal and do some deep diving. And now I'm like, oh, I see. So I'm not mad about it. Honestly, in this conversation we have now, I'm just grateful that I can reflect on it because right now, I feel pretty good. I feel pretty good because I was able to address what physically hurt. I was able to see and hear what emotionally hurt. And then I was able to somatically move through it with journal writing. I love some good oracle pulling. I've been using ChatGPT to like put it all in together, even to give it me some reflections of things that I'm missing. And it's a both and, like both and Eastern, Western, traditional, ancient, emotional, physical, and then some kind of movement through it. And I know it's going to make me stronger on the other side of it. And breathing is the through line that helps me remember who the who I am through all of it.
Yeah, totally. I think people might have a perception that people who have a well-versed yoga practice or breathwork practice or mind-body practice of any tradition are immune to stress and things just like roll off like Teflon. And it's just absolutely not the case.
Well, it's the authenticity, it's not, the goal is not perfection. The goal is to be authentic and real and true. And that, I think, is the practice of breathing well, of being present, all the things that we're talking about. And I think the hard part is it's hard to put it in this nicely tangible package of like, this is what I'm offering, because it's an embodiment. And that's why I think you and I get along, is because we fully embody authentically to our best of our ability what we're practicing and teaching. And honestly, I don't have the space to try to do it inauthentically. I think it would take too much work that I'm not willing to do.
And it doesn't work.
Yeah, it doesn't work.
Yeah, absolutely. Anyway, Perrin, what I really want to talk to you about is a little bit more about your path, because you do such special and unique work integrating breathing with tongue posture, with nervous system regulation. And I'd love to know a bit about how you made your way to becoming a speech language pathologist, a certified orofacial myologist, all of these big, hard to pronounce words that do a lot of good for people. How did you get here?
Really great question. And this can take 10 years, or I'm going to try to do it in like a minute instead. So
Take two.
Well, yeah, two. I would say the condensed version is I started off in public relations for my undergrad and was in Texas and hated it. And I had a cousin that was a speech pathologist and also in Texas. And the more that I hated my job and the more I hung out with her, I was just like, what is this? This is a different type of communication that I'd like to look into. And I was getting homesick. I'm from South Carolina. So I applied to the University of South Carolina and got in for speech pathology, made my way back to South Carolina, where I'm from originally, and started that traditional path for speech pathology and graduated in 2011. So I've been an active practicing SLP, as we're called, since 2011. And honestly, it was like 8 or 9 years just practicing early language articulation, working a lot with language development. I honestly was afraid of the mouth in graduate school, dysphagia, the class on swallowing disorders. I fully did not understand what it was talking about. And spoiler alert, it's because I couldn't swallow correctly and my anatomy was dysfunctional. And I think that disconnect has given me a lot of compassion and empathy of understanding why other medical professionals don't fully grasp sometimes what I'm talking about, because they might be coming from a place of dysfunction with their own body, because that was my path. So long story short, or summarization, basically I figured out I, as I call myself, patient zero, client zero, was dysfunctional. So it took me taking care of myself, and that was learning about myofunctional therapy, thinking it was bullshit because I couldn't do it, getting my tonsils removed, I did have my tongue tie release, my deviated septum fixed, my turbinates reduced, then actually being able to do a proper swallow pattern, actually be able to sleep fully through the night, be able to breathe through my nose, to realize, oh my gosh, I had this all wrong. And my personal connection is I had sleep disorder breathing. I was most likely to fall asleep during graduation for my high school superlative. In college, I was diagnosed with ADHD and given Adderall, which I loved because I could dissociate and I could get shit done, like I said earlier, because I wasn't tired. Became addicted to Adderall, had to get off Adderall, had to slowly figure out what is this myofunctional therapy thing, realizing that was the root of this whole cascading effect of detrimental. Basically, it's like the secondary conditions caused by the primary condition, which was dysfunctional tongue rest posture, insufficient airway space, And as I slowly unraveled those, I got my certification in myofunctional therapy, had some great teachers along the way. And then I got my yoga teacher certification in 2020 because, pandemic, it was a hard year. And then I just started seeing Venn diagrams everywhere of like, oh, speech pathology, myofunctional therapy, yoga, breath. They are all talking about the same thing, but using different language. And I love the idea of being the storyteller of your body, learning the language of what you're breathing and your body is telling you, and understanding that sometimes we're really poor communicators with ourselves because we're not really good listeners with ourselves. And through both professional and personal experience, I have combined my practice where I specialize in airway health, and it includes meditation. It includes mindfulness. It includes physical exercises. It includes a lot of referrals to ENTs and sometimes for tongue tie releases. But ultimately, it's based in how do I get you to functionally breathe, swallow, and speak correctly using the muscles of your mouth, as well as allowing space for any emotional and somatic work that needs to be done simultaneously.
Mm. It's funny. Anybody who's watching the podcast, not listening to it, you would never know Perrin has experienced any of this. She has like the most beautiful mouth. She has the most beautiful wide smile. You would never know. If you see her on Instagram, she's always like showing off her beautiful teeth, where her tongue goes. Like, you would never know. You'd think like you're breathing perfectly your whole life. So goes to show how therapeutic all this work can be.
Oh, I call them the sneaky signs, like a sneaky tongue tie. And that means, so first off, a lot of people don't know what a tongue tie is. It's when the tissue underneath your tongue, which is called your frenulum, your lingual frenulum, is too short or too far forward or just has limited mobility. And essentially, your tongue needs to be able to elevate fully into your palate because behind your tongue is your airway, and we need a full seal of your tongue up to your palate. And that is like the cascading thing. And the thing is, I had a tongue tie, but it was more posterior, more further back, so not directly in your face. And it's those sneaky signs. It's the sneaky signs like I can't swallow pills. The sneaky signs like my mouth is always was a little bit open when I slept, or even when I was just conscious and zoned out or something, like reading a book or watching TV. It's little signs like I get allergies. It's little signs like I got ear infections. It's little signs like I slept hot. Also, there's a little dog in my lap, so there's a little nose poking up if
I know, we're
if
both
you're
in the
watching
Wiener
this.
Dog Club,
Yeah.
and for those of you who don't know, Perrin White, Perrin's dog is Vanna White. Her dog is Vanna White. And that just had to say that.
Vanna just popped into the conversation. It's the sneaky signs that unless you understand the whole picture, they just look like one-offs, or like, oh, I hear a lot, oh, it's just genetics. I'm like, well, no shit, it's genetics, but epigenetics means that we can change it. And you're half of your parents. So I usually will tell parents of children that are clients, I'm like, well, you are your husband, you are your partner. It's one of y'all. So just understand that I want you to work on these things as well. And when you're ready, we'll help you. And when you're younger, we're working on more of the development side. When you're older, we're working more on the stability side, and usually like pain reduction in your jaw, helping to decrease migraines, get better quality sleep, all those things.
Yeah, thank you for breaking that down. I was gonna actually even take it to a more foundational. For those who are unfamiliar with the term myofunctional therapy, can you even break that down for us?
Absolutely. And honestly, I need to like start every podcast with like, here is a key of terms. So the full terminology is orofacial myofunctional therapy, and it's referred to as myo or myofunctional therapy for short. Orofacial, we're talking about the muscles of the mouth and the face. Myo is muscle, functional is function. That's why I call it functional breath work, because I incorporate those. But myofunctional therapy essentially is the retraining and assessing of patterns of the muscles that are used for speaking, swallowing, and breathing. So it's tongue, lips, jaw, throat. And I do a lot of assessment, just watching which muscles can you use independently, which ones are compensating for others. And I get super dirty about what's the shape of your face? What's the size of your palate? Are your nares, the nose holes, are they symmetric? Do you have nasal valve collapse when you breathe in? Like, all these things are signs. And the myofunctional therapy is the actual treatment that goes into assessing, identifying, and then retraining for functional breathing, speaking, swallowing. And it can be to have an orofacial myofunctional disorder, which is an umbrella term that basically encompasses all that I'm treating. It can have one, two, or all three. So it can either be an airway, it can be an airway and swallowing, it can be airway, swallowing, and speech dysfunction. So anyone that has a speech disorder also has a orofacial myofunctional disorder, or OMD. Anyone that has trouble swallowing pills has an OMD. Anyone that has a deviated septum, that has a high narrow palate, large tonsils, that's an OMD. And I can tell you, normally it's airway and swallowing. Sometimes it's airway, swallowing, and speech. Very rarely is it just airway, because the longer we're around, the more our body compensates, because it's not going to let us die, and it's going to use what it has available to get the job done, i.e. breathing, eating, sleeping, functioning. And so even if we're not functioning well, use the term, actually I love how you use the term adaptive breathing. It's going to adapt, i.e. it's going to compensate. And then over time we lose wiggle room. So lots of people like age 40, 35, 38, all these are like, oh, my body's falling apart. I'm like, no, the signs were there. You just didn't know what to look for, or you decided not to pay attention to them. And I get it, because it's overwhelming to take it all in at once. But if you can start to be open instead of critical, so curious about, what does my mouth breathing mean? What does my difficulty swallowing pills mean? Why am I burping or gassy after meals? Why do I have headaches in the morning? More than likely, your tongue and your breathing play a pretty important role with it. And that's what a myofunctional therapist can help you with.
Everything you're just saying is making me wish there's a myofunctional therapist on every block, because I'm sure people listening are having little pings in their head. Oh, I do that. Oh, I have a hard time swallowing pills. Oh, that sounds like me. And yeah, it's certainly something overlooked in, I would say, the wellness space and even the medical space in general. It's so interesting, because the mouth, the tongue, the jaw, the face, it is such a high traffic area in our lives, but one that is under doesn't go under a lot of maintenance as it should. And I know a big part of what you do is work with the tongue. And, the tongue is way more than probably most people conceptualize. If we were to have a chart of the senses, normally the tongue gets just dumped in the category of taste. And it's there to taste our food, taste drink, whatever. But it's actually a very interconnected, big structure. So I'd love to pick your brain about really why tongue resting posture is important, what it should look like, signs that it is adapted / dysfunctional, and yeah, let's dive in there with the tongue.
So I always like to use the hashtag "Where's your tongue?" So we'll just start with, where is your tongue? And I say that because it usually gets people to stop and pause and ask. And there's always the smart ass, like, it's in my mouth. I'm like, well, great, let's dive deeper. And what we're talking specifically about is tongue rest posture. And if you think about rest for the mouth, the opposite of rest is active use. So you use your mouth and your tongue for speaking, for swallowing, for speaking, swallowing, and drinking. So eating, swallowing, drinking, those are the activities where we actively use it. When you are not doing those active activities, that is what we're talking about. That is tongue rest posture. And I want you to think about your entire tongue blade filling up the entirety of your palate, like a foot filling up the sole of your shoe. So the tongue, I want you to break it down into thirds. The tip of your tongue's the front third. The middle, I call it the meat, is the medial. And then the very back, that's the posterior third. We want the tip of your tongue resting at a place that's commonly called the spot. It's your incisive papilla, but essentially it's about 1 millimeter or 2 behind your 2 front teeth. So if you take your tongue, tap it to your 2 front teeth, and then glide it up and back so that you start to feel your gum line, and then just 1 millimeter or 2 behind that. It's the same place where you say na 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 na. That is your spot, and I refer to that as like your home base, your anchor. That is our ground level where we want to get really familiar and comfortable with resting our tongue. So once you find your spot, then see how much more of your tongue you can elevate up into the palate. It might just be 2/3 or maybe half. And then slowly, maybe you get all of it. And an easy way to work on retraining those patterns is clicking your tongue. And then slowing it down. And then ultimately slowing it so much so that your entire tongue blade gently seals to the roof of your mouth. And if you have never done this before, please be kind to yourself, understanding it might take a long time to figure out. It also might be extremely difficult based on the tissue and the anatomy underneath your tongue, which is where we get into ankylglossia, which is tongue tie. So correct oral rest posture includes tongue rest posture. So tongue, front, middle, back is gently sealed to your palate. Now, when we go to the oral rest posture, I want your lips together, face is soft, and I want your teeth behind your lips about 1 millimeter or 2 apart. So if they're touching, release them. So when people say like release or relax your jaw, what they really mean, or what they more accurately could be saying, is bring your teeth 1 millimeter apart. So you want the stability in your mouth to come from your tongue sealed to your palate, not from your teeth clenched together. This is where we get some of those adaptive behaviors. If your tongue cannot seal to your palate, usually you'll bring your teeth involved to find that stability. And just like we talk about grounding in the body, we want to find grounding and stability in the mouth. And if we can't do that with the tongue, which is the preferred and functional and regulated way, because it incorporates and encourages better nasal breathing, it also indirectly accesses the vagus nerve, and it also creates intraoral pressure, which then allows adequate negative pressure being pulled in from the nose as you inhale and then exhale so that no air is escaping. That's where you want to find your stability. And when the body can't do that, normally you'll find people like clenching like a mofo, trying to keep like their jaw stable. And then I also like to say, if you're doing this and your face looks like you're constipated, you're using too many muscles. So the compensation comes when something's difficult, because your body wants you to achieve, your body wants you to be well. So if you're trying something that feels unnatural because of disuse, misuse, or dysfunction, then it's going to use or recruit other muscles to do the job, to get it done. That's where you get compensation from. So that's correct oral rest posture with specific focus on correct tongue rest posture. And remind me the other thing you wanted me to say or talk about.
That's it.
Okay.
I'm sure, like everybody, me, like, and everybody else, we're following along, trying to put our tongues on the roof of the mouth. I'm sure many people, me included, finding a spot that is challenging and illuminating. So that's correct posture for the tongue and some other aspects of the mouth, the teeth. What are some common bad habits or official bad habits to curb that you see a lot?
I'll tell you things that I look out for that let me know that you need my help or someone like me. So probably the most obvious is mouth breathing. And if you're mouth breathing, your tongue is down low. So essentially, for that correct oral rest posture, your tongue has to be sealed up to your palate. And we're not talking like full on seal. So that's mewing. Mewing is like an active exercise that I don't necessarily recommend, but I like the premise of correct oral rest posture with the tongue. But we're not like jamming it up there. It's gently sealed, lips closed. And if you're mouth breathing, obviously your tongue's not in the right place. So that is why mouth breathing is such an issue. It's because it prevents your tongue from resting in the right place, which then is going to dictate the shape of your face and compromise your nasal airway space. Also deviated septums, and deviated septums are a sign there's something there because the roof of the mouth is shaped by the tongue. You need 6 consistent hours of light pressure for teeth movement. And if your tongue does not habitually rest in the roof of your mouth, that is going to then dictate the shape of your palate. The roof of the mouth is the floor of the nose. So if the roof of the mouth becomes narrow and arched, that then compromises the floor that the septum rests on. That then makes it more difficult to breathe through your nose. So that's where people start to get like sinus issues or chronic congestion, postnasal drip. Also, anyone that has chronic ear infections as a child or having like ear pain, that usually lets me know there's some eustachian tube dysfunction. And that again is developed and supported and comes from the shape of your soft palate, which is also influenced by your tongue rest posture, influenced by the shape of your face. So mouth breathing, ear infection, chronic sinus. I'd also say difficulty breathing through your nose, as well as the tongue resting between the teeth. That lets me know that your jaw doesn't have enough stability to maintain that correct oral rest posture. Also, something I look for that's one of those really sneaky signs is when you say la or na or ta or da, those should all be made at the spot. Lots of times people put L between their between their teeth. So it's like la, 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 la. And if you can't see me, if you try la, 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 la between your teeth versus la, 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 la up to your spot, acoustically they sound the same, but it lets me know there's a pattern there of difficulty elevating the tip of your tongue. And if it's hard to elevate the tip of your tongue, I guarantee you it's hard to elevate the middle and the back. I also know that hiccuping or burping after meals lets me know you're probably swallowing air because you probably have a tongue thrust swallow, which is when your tongue goes forward and down, kind of like a smacking noise. And it even doesn't have to be that loud. It can be kind of quiet, but if you have trouble swallowing pills, it usually means there's dysfunction in your swallow pattern. So you're probably swallowing air, and that's called aerophagia. And that comes from an inadequate seal, which is a full seal up to the palate and back versus a tongue thrust, which is down and forward. And that disrupts peristalsis, and that's the beginning of digestion, which honestly starts in the mouth. So if you hiccup or burp or have like any kind of diarrhea or actually it's really more constipation, but any digestive issue, I immediately want to know, how are you swallowing? If you're a slow eater, if you're a super fast eater, if you like constantly are like sipping water during meals, I'm curious how stable your jaws are. And I would say also the sleep. So sleep is like a whole nother category that goes in deeper. So think of like anything that I'm looking at, there's a nighttime behavior and there's a daytime behavior. The daytime behavior we can like see and observe during evaluation. But I'm going to ask you a lot of questions about sleep. So if you don't breathe well during the day, I know you don't breathe well during the night. And if you wake up hot, if you frequently wake up, if you have to use the restroom a lot when you're asleep, lots of times bedwetting with kids, like prolonged bedwetting, that's a sign that they're not getting deep restorative sleep. If they're sleeping restlessly, so I tell kids, like, do you have like sheets exactly the same, or does it look like tornado sheets when you wake up? And even adults that are alone, I'll say like put a pillow right beside you, or set up like a booby trap, like put some pillows beside you and see, are the pillows still there, or have you moved them when you wake up? Those are all signs. If your mouth is dry, if you're drooling, if your jaw hurts, and then especially if you wake up with headaches, that lets me know there's probably some insufficiency happening there. And then there's all sorts of things associated with hyperventilation or overbreathing, which I'm sure you've talked a lot about. I love the Nijmegen questionnaire. That is my all-time favorite go-to easy free assessment, and it lists all these things that associate with overbreathing. So it's like tingling in your fingers and hands, dizziness, ringing. I think there might be ringing in your ears. If not, that should be in there. That's in there too. And then like tightness across the mouth. Oh, Another one, usually people will tell me like, oh, I hate going to the dentist because my mouth gets so tired when they put those cheek retractors in. That is a huge sign. If it is like hard for you to keep cheek retractors in, there's some definite tension and restriction happening. And then when you're an infant, usually there's breastfeeding issues or reflux or GERD, even GERD and reflux as an adult. I mean, like, if you haven't noticed, the list is exhaustive. Like it is extensive. It is all encompassing because, spoiler alert, your breath impacts everything.
I am so aware of my freaking tongue right now. Like to the point where I'm like having saliva in my mouth and drinking tea. I'm like, oh shit.
So say that saliva, girl, that means you're working hard. You get that saliva production.
Well,
things are moving.
Well, I also have like 80 new questions. So,
Perfect. Perfect.
I want to backtrack a little bit. You said so many provocative things. First of all, I want to go back to the vaulted palate from chronic mouth breathing, poor structure of the jaws, teeth, tongue, etc. Poor breathing. Kids versus adults. How reversible or fixable, trainable is it in adults versus kids, which I imagine are much more malleable up to a certain age?
Yeah. I think it's a Theodore Roosevelt quote, is like, you do the best you can with what you have where you are. And so I always start that because my ultimate goal is to help someone breathe well right now. And depending on what kind of anatomy you have, I guarantee you we can find a way to help you breathe right now, because I don't want your body to say, I'm broken, I'm bad, something's wrong with me. Even if it's not operating the way you want, I always start off with like, we will find a way to help you breathe right now. So starting off there. Now, after that, we really get into what patterns can we start to stabilize and habituate, meaning let's just see what your tongue can do when you start doing some consistent practice. Let's start seeing how your facial shape changes, or your muscle structure changes, or your stability and your stamina changes. And I usually say 4 sessions over 2 weeks. 2 weeks apart, because it takes on average like 66 days for a new habit to stick. And I always want to at least start, I call it breath boot camp, like these 4 initial treatment sessions. I do that with kids and adults. And I do it for adults because I want to see, one, what can you actually accomplish when you are trying with correct instruction? With kids, I want to know, like, are we going to be able to work together? Are you actually going to practice? And same with adults with that. Now, as far as what's able to shift and change with consistency, I can use myself as an example and then some clients. So I got my tongue tie release in 2018. And then in 2018 to 2024, I gained 3 more millimeters, either 2 or 3 more millimeters in my palatal width, which is pretty big for natural palatal expansion just from tongue rest posture alone. So come back to that. It takes 6 consistent hours of light pressure to get teeth movement. That's what braces and retainers do. That's also what your tongue does, but you have to train your tongue to stay there all throughout the night consistently for that to happen. And what I'm talking about in adult changes, and what I've seen in myself, is more symmetry in my face. I've also seen more advancement of my maxilla, which is the upper jaw. Now, I'm a complete nerd and almost like neurotic about this because I love it and I do it and it's interesting to me. Honestly, for adults, I just want you to be able to sleep through the night. I want you to be able to chew your food. I want you to be able to feel good in the morning, and I want you to be able to have tools to regulate yourself. If you can maintain that, depending if you have a tongue tie, we're going to send you to the ENT or the tongue tie release specialist, depending in your area, if that's a dentist or the ENT or another provider. Then we're going to help you heal. And that is really going to be a huge shift, because then we're going to start changing the structure of your fascia, and we're going to start remodeling your fascia, which paired with your breathing consistently every single day will make a big impact. And then depending on how narrow and how high your palate is and your bite, and it is like a complete work of art essentially for every single client. And there's things that are the same with lots of them, but Sometimes you need adult palate expansion. Sometimes you need jaw surgery as an adult. And that's really up to the client. Like, how far are you willing to go? What can you do now? What can you maintain? And I say slow and steady. So I start with 4. If you're going to get a tongue tie release, usually it's another 4 after that to make sure you heal. And I'm going as slow and shifting as small little bits as I can, because I want them to stick for the rest of their life. And then with kids, it goes a lot quicker, because kids are essentially like Play-Doh. So they're Play-Doh that's been pulled out, and it's fresh and it's gooey and it moves really easily with the tongue, with your swallow, with your pressures of your mouth and your lips and your teeth. They will be influenced by the way you breathe and the way you rest your tongue. Those we can really get palatal width and shifting of the bite and alignment of the posture by changing the strength and stability of the tongue. They normally most of the kids that I see need a little bit of palate expansion. Sometimes they need their tonsils removed, or turbinates reduced, or tongue tie releases. But kids are amazing. It still blows me away, like what I've been able to see, like completely reducing sleep apnea or sleep disorder breathing, decreasing attention deficit like qualities or habits that parents have noticed, being able to sleep through the night, being able to enjoy a meal, being able to stay seated, being able to regulate their emotions better. And then with adults, I just want to get them out of pain. Like, a lot of them have chronic TMJD. Their jaws hurt. Their stress and anxiety is through the roof. And I want to find them a place of stability. So change is possible at any stage. My oldest client is 70 years old, and she had a tongue tie release and had remarkable results with her sleep, as well as her bite, as well as with her tongue range of motion and her perceived ability to breathe deep. And what I can tell you with kids is, we're just setting them up for the rest of their life. Like, how do we create a more solid foundation so that they can actually sleep and eat and do all the things, so that then they can get busy doing all the other things, like applying for college, being able to build friendships, being able to build resilient immune systems, and then everything in between. And I know I wish I could give you like a formula of like, this was what will happen, but I'm constantly amazed by what is possible. And you just have to give your body a chance and say, like, I'm here, I'm listening, I'm ready to put in the work. But usually you see changes in facial structures, you see changes in posture, you see changes in ability to breathe slowly and deeply, and their emotional regulation and their sleep, all sorts of things. And it can happen at any age. It just depends on how serious additional interventions are needed based on where you are at your starting point.
I love that. There's hope.
There's hope. There's always hope. I didn't start my journey till age 34, and I'm 40 now, and I'm not perfect, and there's no perfect. Like, you're so kind to say I have a nice smile, but I have a crossbite. There's asymmetry in my face, but I also think that makes me perfectly imperfect. And it's finding that balance between the two. And sometimes we can get really hyper-focused on what is perfection, what is normal. It's like, what's functional? That's what I want to know. What's functional and what keeps you regulated? That is my number one goal.
Before you fast forward through this, don't miss your 15% discount on Ayurvedic wellness products from Banyan Botanicals. Use the code KARI15 to save on oils, herbs, cleansing essentials, teas, and more. That's KARI15. The link you need is in our show notes. You deserve to know exactly what's in your greens and protein powders. That's why Vibrant Health fully discloses every ingredient by dose and never uses proprietary blends. Save 20% on your next order with the code BETTER_YOGA. That's better_yoga for 20% off Vibrant Health supplements and superfoods.
You're perfectly Perrin. That's all I need to be.
I like it.
Okay. I still have more questions from your earlier just absolute download. Okay, you briefly mentioned mewing, and I think
Mm-hmm.
mewing is something people may have heard of, um, in certainly in maybe breathwork communities, maybe other listeners who have found us. Talk to me about why it's not necessarily an approach you take, what it is, and what you have people focus on maybe instead.
Well, just a little background. So John Mew was an orthodontist. Actually, there's a father and a son, and I get them confused sometimes. Like what? I think they were both named John Mew. So they're the Mew dad and son, and they're in England, and they were really advanced with orthotropics, which is the the field of orthodontics and changing the shape of your face with slight shifts and pressure. So you're trying to change the face from an early standpoint with function. And John Mew, I think that the son is the one that really popularized mewing. And in myofunctional therapy, lingual palatal suction is what we call a tongue cave, which is when you really suction your whole tongue with force and effort up to your palate. And that's what I do a lot on my Instagram channel. So I'll put my whole tongue up to my palate, open my mouth. And I want you to think of this as a yang. So think of like yin and yang. So fully suctioning your tongue up to your palate is an active exercise. It is taking intention. It is like stressing the muscles. It is absolutely force. You are forcefully putting your tongue up to your palate. Now, there's a time and place for force. There's also time and place for softness. And I tell my clients, like, we are done white knuckling through life. That's normally where I see like clenching, grinding, like SCM muscles just popping out of their neck, like all sorts of stuff. And they are in a constant state of stress and tension. And the body doesn't like that. That also is a vasoconstrictor, meaning you can't get adequate blood flow through your body. So if you are constantly trying to suction, just cram your tongue up to your palate all the time, good God, your face and your neck and your vagus nerve and all the systems in your body, they are going to be exhausted and tired. So I like more of a balance. I use tongue caves, which I think there's can be some variations in the names of all these exercises, but a tongue cave is when you fully suction your entire tongue up to your palate, open your mouth, and that's normally what people will use to see like how strong their seal is. And I love tongue caves. I love tongue caves. I don't want you to do a tongue cave all the time because that never gives your body time to rest. So if we're going back to the both and, you need both force and you need restoration. You need both the active yang and you need the restorative yin. You need the inhale and you need the exhale. So mewing is a very forceful exercise that actively suctions the entire tongue blade up, but that also makes it really hard for your nervous system to find regulation. It makes it really hard for blood to have adequate flow throughout the body, for the lymph to be able to flow adequately throughout the body. And I just don't want you to be in a constant state of tension. Now, people that are actively seeking like hot yoga or powerlifting or like extreme anything, they're probably going to resonate with like more mewing, more. But in my world, if you want to get adequate sleep and adequate rest and proper digestion, your body needs to be in a state of parasympathetic, and you're not going to get that if you're constantly mewing, forcefully white knuckling your tongue up to your palate all the time.
Mm, yeah, that makes a lot of sense. Thank you. Okay, one more little technical question. This is really just all the stuff I want to know. You
Sure.
mentioned swallowing several times, and I just swallowed. And I know that there are some very telltale signs of quote unquote dysfunctional adaptive swallowing, a lot of head bobbing, like there are things you can definitely see. I've been told before that you shouldn't really be able to discern all that much that somebody's swallowing. The head stays very calm. So I'd love to know about what is the right way to swallow, just normally when we're not drinking or eating, and then when we're drinking and when we're eating.
Yeah.
Because I've seen you on Instagram with like straws and all sorts of things, and just want to know what's going on there.
Yeah, honestly, I don't get to talk about this as much, so I'm excited. And just understand, you're not supposed to be perfect all the time. This goes all the way back to what we talked about at the very beginning. I'm looking for authenticity and intention, not pure perfection. Additionally, I also am a recovering tongue thruster, mouth breather, so I still have to practice a correct swallow pattern. So, what is a correct swallow? So, whenever you're eating food, chewing it up, it turns into a bolus. That's the term that we use for any like food like substance that's going to be swallowed for nutrition purposes. And your tongue should be able to create a bowl, which is this. Can I like visualize? I'll describe
do
it.
it.
As I say, okay, so a tongue bowl is essentially when the front, the middle, and the sides. And an easy way to get into a tongue bowl is a taco tongue. And then you lift up the front. So taco to bowl. That essentially is in your mouth, and that's where your bolus, after you fully chewed your food or your pill, is going to go. Then you suction it up to your palate with your tongue tip to your spot, glued there intentionally, and then swallow without your tongue coming forward against your teeth. So it looks like this. Eh? Mm, mm, mm. And I kept my lips open so you could see my mouth. If liquid or your tongue or your food comes forward, that is a tongue thrust, thrusting forward versus up and back. And it lets me know there's probably some tension or restriction or misuse or just habitualized adaptive swallowing patterns that make it difficult for the mid blade of your tongue to elevate during the act of swallowing up to your palate and back. And anytime you've like choked or gagged or felt like something didn't fully go down, usually it's because your swallow pattern is involved and there's some adaptive swallowing there. Then additionally, another way that I look at clients is I'll have them take a sip of water and then put their cup down, and all I want to see is the throat bob. I don't want to see any lip compensation or pursing. Yeah, try
I'm
it.
gonna do it now.
Yeah, try
Yeah,
it.
this might be a good podcast to watch.
Don't spill the water. Keep it in your mouth. Lips closed. And yes. All right. You had a little bit of lip movement.
Try not to
Right.
laugh.
I know, because it's weird. I tell clients this is a good party trick, and don't beat yourself up if it's hard. Also, take the smallest sip possible. You can even just get a little saliva in your mouth and see if you could do it. That was better.
Yeah,
And
no, I
yeah.
definitely noticed the movement at my lips.
And what I think is so cool, and this is where I love the yoga background that I have, is I feel like the act of swallowing is a vinyasa. I mean, the postures of your tongue that are needed to string together to create the whole flow of swallowing is a bowl. Well, first off, you have to chew your food, keep your lips closed, so you're not compensating by like mashing your lips together. You're actively using your masseters. You're chewing side to side. You're using your tongue to lateralize on both sides of the dental plane. And then you collect the whole bolus or the liquids, whatever you're chewing or swallowing or consuming. And then you put it in your bowl, and then you suction your tongue up to your palate. Your tongue tip glues to your spot and stabilizes as the blade itself does this wave-like motion. That's the peristalsis, and then allows all the contents to go into the esophagus and into the digestive tract. And you're stabilizing your teeth, you're stabilizing your jaw, your lips, so that just the tongue moves during the act of swallowing. And this is the cool part. Like, that's airplane. That's dancer. It's like, what's the one isometric movement we can do for the act or the flow of swallowing itself? And that's like where my brain goes, is like, the flow of swallowing, because it takes all these little teeny pieces collectively strung together as this cohesive act that then goes into the swallowing. And then I feel like you're really good about this, is like, how do we then invite mindfulness? Like, can the act of swallowing be a meditation in itself? The gratitude of chewing as we're putting the tongue up and swallowing. Also, I've had to like check in with myself because I'll get really busy and I have to tell myself, Perrin, sit your ass down and slow your roll. Like, I literally will catch myself standing up in the kitchen eating. And I have to remember, oh, this is something I have to be conscious about, because our body will get the job done, but we've got to give it a little bit of intention if we want it to do it well. So that includes, like, if we want to digest our food well, if we want our food to fully absorb the nutrients, if we want to be able to swallow without swallowing air, because you're going to hiccup or burp. And that's my tell sign that I'm not doing it mindfully, is I will burp, like burp, burp, burp after a meal. And it means I swallowed air because I didn't fully seal my tongue up to my palate, because maybe I didn't chew my food adequately enough because I'm in a hurry and I'm not paying attention. And so you stop, you pause, you take a mindful swallow, and then you try again.
Cannot wait to eat lunch. I'm going to be doing yoga, eating lunch, doing my tongue vinyasa. I love that word.
Yes! Oh my God, it's a tongue vinyasa!
Amazing. Man, this podcast could go on for 3 hours. I have two more technical questions for you.
Sure.
I just want to talk briefly, and maybe it won't do it justice to talk so briefly, but just like the top contours, the highlight reel, breathing and sleep. Like, what are the habits people could start doing tonight, given that, they're moderately healthy, they don't have any conditions that are going to bar them from some of these practices? What do you recommend? Just basic airway sleep hygiene.
I love the idea of hygiene, because it's like a practice of how do we maintain these beautiful systems that we've been given. So for adequate sleep, your nose has to be clear, your tongue has to rest in the right place, and you've got to be able to at least get down to the diaphragm. Like, it's going to be slow, it's going to be quiet, I don't want to hear you. So I would say start with your tongue rest posture. Like, can you get your tongue to spot? Can it stay there? And let's say it's 2 nights. So the first night, I want you to really think about it. And if you can, when you wake up that morning, as best you're able, the first thing I want you to think about is, where's my tongue? Are my lips open? Have I moved? So, like, get some information, get some data. And if your mouth is open, maybe you try some mouth tape and use it as lip training. But I also like mouth tape during the day before you just go straight into the night. But really, I want you to take one night just to notice first thing in the morning, like make a conscious effort to think about it the night before. So the first thing you do when you wake up is, where's my tongue? And are my lips closed? And if your tongue is not on your spot, and ideally if your whole tongue blade's not to the palate, that's a sign you need to work on your tongue. If your lips are open, that's a sign you might need to help with mouth tape. And if your tongue can't stay up, then the mouth tape might not work. And then 2, if your nose is blocked, it might not work. So use like a nasal dilator or breathwork strips, and just slowly see what your body can do. Also, you can look into Oxygen Advantage with some nasal unblocking. I mean, like creme de la creme. I'd love like some nasal unblocking. Plop on a breathwork strip. Do some tongue clicks, check in with your tongue rest posture, and then use some mouth tape and just see what happens. Your body's not going to let you die. You're going to peel it off if you can't handle it, and that's all going to be information. If you can't sustain it, or if you can't get it done without the breathwork strip, that you need some myofunctional help, some functional breath work, yourself or myself, to work on some of the breathing re-education.
And I'll put links to all those things below for people who are like, what is mouth tape? What is a breathwork strip? Welcome to our world.
Yes.
You will find out.
Yes.
That's great. Thank you. All right. One last little fun thing, because I know it's very popular on the internet, especially in the breathwork circles. What is your take on gum, the mastic gum, like chewing practice to strengthen the muscles?
Oh, wait. I've got some gum that I bought literally, like, I think the gum you're talking about has like no taste, and it's really,
it's disgusting.
Yeah. I want some kind of resistive chewing practice. I want it to be functional, and I don't want it to hurt you. So start slow and steady. Honestly, chewing. Just chew some food that you actually have to like put some effort into. Not after you've had gum grafting surgery like myself, but what I would say is I want some serious chewing. Now, try the gum. If the gum works, awesome. If you hate it, there's other options. So I use this Tri-Chew. It's a Beckman Tri-Chew a lot. It is resistive chewing. Just like you go and do resistive exercises in the gym, you're going to do the same thing for your masseter. I take one of the sides, you put it on your back molars and chew 20 times in a row. Second level, chew with your tongue tip to spot simultaneously. And then do the other side. A dog
like
toy.
One of Nana's toys.
Yeah. Luckily, she has not got her paws or jaws on that one.
would be a no starter.
God. So, and then there's things like MyoMunchie and MyoMate for younger kids. I have one, honestly, and you can do some consistent chewing. But the best way naturally is like chew foods that are mechanically nutrient rich. That's a Katie Bowman term, mechanical nutrients, where like, can you actually chew it? Like, I need you to chew it. So use something that you have to actually put some effort into and consistently. And then if you want to like actually work out your jaws, there are some things that I think are helpful. I like therapeutic tools like Beckman Tri-Chew. There's also some different resistive chewing tools that you can use. I like MyoMunchie for adults and for kids. And then I would say just beware of anything that's in the front part of your mouth. You want it to be more on the back molars, or you want it to be throughout the whole mouth as a whole. Because if you only focus on these front teeth, you're really missing the masseter, and you might put yourself at risk of more TMJD pain, which we do not want.
Well, I'm going to order myself a chew toy, and I'm super excited.
Absolutely.
Man, Perrin, I've learned so much in an hour. Wow. Okay, we have a closing tradition on this podcast. We ask the same question. If you weren't doing this, what would you be doing?
Oh, that's a great question. That is a great question. God, I don't fully know, but I feel like it would be something in the helping world. Like I can't do. I don't ever want to do anything that doesn't help others, and I love the artistic expression that and creativity that my job allows now. And I would love if I was an artist. I would love if I was a painter. I've tried sculpting and I've tried pottery. That's really hard. I don't think it would last very long, but I wish I was a painter. Maybe I was a painter in a second life or a past life. Or maybe I'll take it up. I don't know. We'll see.
Well, if you do, let me know.
It would be like a little kid drew it. That's going to be my painting.
We can have you on about the vinyasa of painting.
Oh my gosh, the brush strokes. Oh, I'm losing it.
That's okay. You just dropped wisdom bomb after wisdom bomb for an hour, and thank you so much. Hopefully everybody who's listening to this, like me, has just learned a lot about their own mouth and their own face. And as I said, I'm certainly going to have a very interesting lunch in a few minutes. So thank you so much.
You're so welcome. Let me know how it goes.
Oh, I will. I'll text you. I'm just going to start sending you videos of me like swallowing. Is this right?
I'm like, make sure you have your throat in the picture. I need the mouth and the throat simultaneously.
And then I'll send you that little Apple Cash button as I send the video. $20 a pop.
I won't say no. Thank you.
All right, Perrin. This has been delightful. Thank you. And I hope everybody is knowing where their tongue is at the very least.
Yeah. Where's your tongue?
Where is your tongue?
Where's your tongue?
That's what we're going to name the podcast.
Perfect.
All right. See you next time.